And in other news, new guidelines by a medicine's watchdog recommend against starting opioid painkillers for people with a certain type of chronic pain. Instead, they advise to try exercise, talking therapies, and acupuncture. NTD's Neil Woodrow brings us the story.
The National Institute of Health and Care Excellence, or NICE, in new guidelines says people suffering with chronic primary pain should not be prescribed opioid painkillers. Chronic primary pain is pain that lasts for more than 3 months and has no clear underlying condition. Between 1 and 6% of the population of England is estimated to suffer from chronic primary pain. The NICE guidelines point to a lack of evidence on the effectiveness of opioids for such type pain. At the same time, the long-term use of opioids carries an increased risk of dependence. I spoke with Dr. Rajesh Manglani with almost 30 years' experience in pain management.
In the last year or so, I think there have been about 5,000 people dying from opioid-related deaths in this country. And the worry is we're going to follow the United States in the opioid epidemic that has occurred there.
The NICE committee also agreed that they could not recommend starting anti-epileptics for chronic primary pain, of which gabapentinoids used for sharp shooting pain are a class of painkiller already associated with substance misuse and dependence.
Such drugs are very good anxiolytics and sedatives. That means they reduce anxiety and cause sedation, so often they're really good at nighttime. But those qualities also mean that they can become drugs of abuse. So unfortunately, a proportion of patients become addicted.
NICE also recommends against starting the familiar anti-inflammatory drugs like ibuprofen for chronic primary pain. That's because of the risks of harm such as gastrointestinal bleeding and the lack of evidence for effectiveness. Instead, the guidelines is recommending for the initial stages of chronic pain alternative methods such as acupuncture. It says overall the committee agreed that there was a large evidence base showing acupuncture to be clinically effective in the short term. The original economic modelling also showed it is likely to be cost effective. The guidance for acupuncture says a course has to be delivered by a healthcare professional with appropriate training and is made up of no more than 5 hours of healthcare professional time. The guideline also recommends exercise. Most of the evidence was from professionally led supervised group exercise. It says evidence from many studies showed that exercise reduced pain and improved quality of life compared with usual care in people with chronic primary pain. NICE indicated several areas for further research. NICE is saying that your GP may now be recommending a course of acupuncture or exercise instead of drugs the next time you visit with your chronic pain. Neil Woodrow, NTD News, Epsom, Surrey.